This episode is sponsored by Lilly, a medicine company turning science into healing to make life better for people around the world. Lilly has been pioneering life changing discoveries for nearly 150 years, and today, its medicines help more than 51 million people across the globe. Harnessing the power of biotechnology, chemistry, and genetic medicine, Lilly scientists are urgently advancing new discoveries to solve some of the world's most significant health challenges, including transforming the most difficult to treat cancers into manageable diseases. Hi, everyone. This is Samira Daswani, the host of the podcast, The Patient from Hell. I have a very, very special guest with me. I have Aurora with me, and she's here to tell you about her story navigating cancer. Now, Aurora, I've known her now for 4, 5, 6, 7 months, 6 months, 7 months. Aurora, what's it
Mhm.
been? A while, right?
Yeah, about like I think 6 or 7 months, but it feels longer than that.
It does feel longer than
Mhm.
that. I had
Mhm.
the pleasure of meeting Aurora in person this past
Mhm.
weekend. Aurora, you want to start there? Like, what were you doing in Atlanta? What took you
Yeah.
there?
Mhm. So I met you this past weekend in Atlanta. It was my second time going to the Hope Summit. Was it your first time?
First time.
First time? Yeah. So I came back actually to the Hope Summit this time as a speaker. So that was very different. But I was uh, I was like, don't let that get to your head. Let me just be a patient. So that's how I was navigating the summit. Mhm.
Just that there are so many things to tug on. All right, so let's start with what's the Hope
Mhm.
Summit and what were you speaking about?
You're right. So the Hope Summit is pretty much getting everyone together over the weekend, a lot of lung cancer survivors, patients, also their caregivers, right? And really just genuine people around you. I think just really caring people who actually care about getting lung cancer research funded and awareness out there and fighting stigma.
Okay, and
hmm
what were we talking about there?
I was talking about, navigating lung cancer as a young adult patient. And for me, I'm really all about talking about taboos. So I was like, let's talk fertility and how really nobody talks about that when you're a young lung cancer patient. And for me, being an Asian American woman, that's such like a hard topic, especially if the doctor's not talking about it. I'm like, should I talk about it?
Hmm.
Mm-hmm.
All right, before we jump into fertility, can we go
Mm-hmm.
back to what happened? Like maybe
Mm-hmm.
roll back to a few days before diagnosis and tell us about it.
Mm-hmm.
If that's okay.
Mm-hmm. Definitely. My first symptom that I had, I'm actually considered lucky for having a symptom. It was in August 2021, a few days after buying my first home. I remember sitting in a parking lot in a completely new, different city, and I was like, "Oh, my chest hurts." I was like, "Okay, just like breathe." I thought it was anxiety because me being an overachiever, I feel like anxiety is just a normal part of everyday life. And also adulthood, you're trying to achieve things that people are telling you to do. So I remember calling my sister and she's like, chest pain, that's really bad. You should go to the emergency room. And I said, girl, I just spent all this money. I'm not about to dish out another 250. I remember her just kind of trying to calm me down for an hour and she said, well, if this lasts longer, you should really go. And I kind of just dismissed her because I thought my sister was just being a reactive person. I think for me, I was like, I'll just fight through it. So that was the first sign in August, but it actually came back just less than a month later in September. And when that happened, I was like, okay, here it is again. I'm like this mysterious chest pain. Let me make an appointment with my primary care physician. I never really saw the doctor before that. Like the yearly checkups, I would always skip because I'm usually healthy. But when I finally made that appointment, I had to wait like a few weeks for it, and he said, "Oh, like you look great. Like, what are is there any concerns that you have? And I said, well, I'm always tired and I have this chest pain that was happening. And sometimes I cough. And he said, but you're very young, and you look great. You should go home and boil some honey. Yeah. So that was a
What?
big part. And I remember just staring at him. I said, what? I was like, there's something wrong. And he kind of said, let's wait a few weeks. Like, go home and boil some honey. You're okay. And I'm pretty sure just like a week later, the chest pain came back and I walked myself to the emergency room. I left school early because I was a school teacher back then. And my sister was like, you should tell them about chest pain because they're going to pay attention. And I was like, it doesn't hurt that bad. She's like, you don't have to tell them that. Just say it hurts and tell them all your symptoms. And they actually found something with my heart, which is Wolff Parkinson's White syndrome, which means there's an extra electrical pathway. I said, who's that? I was like, who is Wolff Parkinson's White? Because it was so long.
Mm.
And the lady was like, I don't know, probably the man who had found this like thing. And so, yeah, she explained that it was an extra electrical pathway. And then she said, can we admit you? Are you okay with it? And I said, sure. And I was in the hospital for 2 days.
Oh.
Hmm.
Wait, so how did
Yeah.
they go from like a heart thing to a cancer diagnosis?
Yeah. So that's a really good question because I was like, oh my God, they finally figured out why I have chest pain. And my husband was like, wait, your heart's on the other side of where the chest pain's happening. I said, you're right. Like, that still doesn't make any sense. So actually, the second day that I was in the hospital, this hospital that I was in, there were residents always following the doctor. There's like 5 or 6, 7 of them, a big group. And I remember them kind of just like piling up around my hospital bed, and they said, "Oh, something's been found on your CT scan." And I said, "What is it?" They said, "Well," before they even told me what it was, they were like, "Where were you born? Where were you raised? Have you traveled lately?" And I said, "Well, I was born and raised in the Philippines." And they were like, "Maybe it's tuberculosis." They were like, "Have you traveled?" And I was like, "Yeah, I travel often." And they're
Mm.
like, okay, the past 10 years, where have you traveled? And I was like, you really want me to list out everything? I've traveled to over 20 countries, but I was like, that can't be. I've always had like medical stuff done and vaccines. So in my head, it just wasn't making sense yet. I remember this one resident, she like kind of held my hand and was like staring at me. And I said, okay, like she's telling me what's up, but she can't say it because she's not like my actual doctor. Um, so after that meeting, and then they kept staring at my hands. They would always lift it up and they would always look at my finger without explaining it. I later found out why they were doing that.
Why would they
It
do
act
that?
so yeah, so actually the curving of your fingers could be a symptom of lung cancer. Yeah.
Whoa, what?
Yeah. Yeah. Mhm. Yeah, so my fingers back then were like really like bent. I didn't notice it because I never get my nails done or like really stare at them. But I remember that was so strange. I was like, why aren't they just staring at my hands? Like without really explaining it. And back then I wasn't really asking a lot of questions. I was just like, okay, you know, um, yeah. So that was the first ER visit where I was admitted, and they were like, well, due to like insurance, we gotta let you go, but you do have follow-up exams. I was like, so at first I said okay, because I was still trusting the system. I was like, okay, I'm gonna get those PET scans, we're gonna figure out what's wrong. And then like hell kind of happened the next week where they were like, oh, you can't get your PET scan because of insurance. And they were like, your PCP is not approving this PET scan. Yeah. Hmm.
I'm trying to breathe right now. Please keep going.
Yeah, yeah. So I've been meaning to count how many times I was in and out of the ER, but I remember going back, let's say like 3 weeks later, and I went back to that same ER because I didn't know what to do anymore. Like I was coughing, I could barely talk, and my family was like, you need to go back. You shouldn't be waiting for people to arrange appointments because what I was doing at that time was I went back to work and was trying to just live. Um,
Yeah.
and then I was waiting for like the people to like set up the appointments for the insurance to pass. and nothing was happening. My sister was calling my PCP's office. They weren't answering the calls, or they actually hung up in the middle of sometimes my sister like trying to ask. So my family was like, why don't you go back to the ER, try do something there, anything
Yeah.
was like. So I went back and the doctor was like, well, your insurance isn't like accepted here or what. She's like, this is going to be a big bill for you. And I remember just like begging her. I was like, there's something wrong and I don't know what it is. And I just stared her in the eye and she's like, okay, like, and she said, there's like COVID and like there are no beds, pretty much she was saying. And I said, please, like, admit me. And she felt bad for me. So she's like, okay, I'm going to try to help you. And so that second time, I thought they were going to figure something out. We were pretty close. Oh my gosh, I feel like taken back. And they actually that time did a biopsy. So this is around late October coming to November. And so they did the biopsy and I remember calling back like their office. I was like, what are the results? What are the results? What are the results? And they said it's inconclusive. So we got the test and they didn't take enough like
Oh.
samples. Yeah. So that happened. And so the window of insurance happens around November to December. My sister works in the like administration healthcare field and she said, wait, she's like November, December, you could change your plan. So we actually switched finally to PPO and she's like, okay, we're going to go to another healthcare team. And so December 1st, I remember having like an appointment set up with a brand new PCP. And I remember going into his office and just kind of doing the word vomit. I was like, whoa, 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 this has been happening the past 3 months. And he's like, okay, I'm going to try to get you your test that you need. I'm going to flag this, like red flag it because it's urgent. And
Yeah.
so I remember him making like those calls and he was like, well, if this is what you think it is, these are going to be your oncologists. And I was like, what? That was just an hour versus like 3 months of me trying to over explain everything. And yeah, from there, everything was like sped up with this new healthcare team. I was finally, well, my pulmonologist appointment was December 3rd. And I remember going in there with my aunt, and he was like, well, we'll get you an appointment in like 2 weeks. And I remember my aunt standing up, and she was like, well, if she gets a blood clot, this is on you. Because he had no sense of urgency. And so he was like, oh, okay, and then he actually got me admitted that day. And um,
Wait.
yeah, it was a lot. It was a lot. And
Oh.
then
Oh.
upon that admission, we had to wait for like a biopsy appointment. So finally, December 6th, I got my lung cancer diagnosis. I remember the doctor just looking like his eye bags, he had like eye bags under his eye bags. He just looked so exhausted. And he looked at me. I was like, lung cancer before he could even tell me. He's like, yes. And then I said, what stage? And he said, stage 3A. And I said, wait, I was not expecting that because I remember just looking at that CT scan in September. It was like tiny. And then by that time in December 6th, it was three large lime-sized tumors.
Aurora, how did you know it was lung cancer
Yeah.
before he said
I,
that?
Google tells you a lot of things. And I think my body felt that there was something wrong. And I was like, okay, they're talking about this tumor. Yeah. So I think I just had that feeling, oh, good question. So when I had my PET scan done in November, my best friend, who's my cousin, she does like I forgot sonography. So I had given her the image, and she cried to my sister. She's like, "Oh my God!" She's like, "It's all lighting up." And she also worked with breast cancer patients, so she knew. She called my sister before telling me. So, but them being in the healthcare system, they were like, she needs all the right tests to actually get, even if they knew what was going on already, they needed the actual documentation. hmm Yeah. And even some things, I think I look back at that time, I was like, so many doctors were in denial this was actually lung cancer. One of them even said, I'm going to pray that this is not lung cancer. I was like, sir, like, that's good, but like, I need this test. I need you to help me. I need you to push this forward. Yeah. He's like, I am so sure this is not lung cancer. And I remember my husband was like, yeah, it's not lung cancer. Because they were like, if you think it, that's what's going to happen. Yeah.
Uh, the
Mm-hmm.
thing is, I don't normally get stumped on this podcast. I
Yeah.
feel a little stumped because one, there's a lot of correlations. Like I definitely I don't think
Mm-hmm.
it was as much of a like long drawn out process,
Mm-hmm. Mm-hmm.
but I distinctly remember being told about cancer not by the healthcare system.
Mm.
I knew before we showed up.
Mm-hmm. Mm-hmm.
And it's weird. Like someone was asking me recently, they were like, the doctor calls you and like most likely it's an in-person face appointment. And I was like, no. The odds are Dr. Google is
Mm.
telling you. That's the odds. The odds are Dr. Google is
Yeah.
telling you. Before
Mm-hmm.
we're even seen by the oncologist these days, right? So today,
Yeah.
odds are Dr. Google tells you that you have cancer.
Mm-hmm. Mm-hmm. And odds are if you're connected, I think, with your body, your instincts are already screaming that something's wrong. Mm-hmm.
Aurora, so December 6th, stage 3A.
Mm-hmm.
What happens after that?
So the oncologist came and she talked to me and she said, well, now we gotta do scans for your whole body just to make sure it hasn't spread anywhere else. So they did. I remember them doing the brain scan and she sat me down. She's like, there's something in your brain, but it's benign. Like they were just kind of saying it was benign. I said, oh, okay. And then they did and then she said, there's something I wanted to bring up with you. Have you thought about having kids? And I stared at her. I was like, I've been thinking about that the past 3 months, because we were newly married. I was like, but I didn't know how to ask because I'm trying to live. And she said, well, like, you could think about it. If you want to do fertility treatments, we're going to have to delay your treatment plan. And I said, what do you mean by delay? And she's like, well, harvesting your eggs, you have to do like medication and injections and appointments.
Yeah.
And I said, how long would it be delayed? And she said, maybe 3, 4 weeks. It's really up to you. It's your decision, end of the day. And I remember just like crying. She's like, I'm going to give you a moment. And then that's when I like cried like a little. I was like, ah, and my husband had to like hold me. Yeah. And actually, yeah, I told him, I was like, well, we're going to do that because we want kids. I was like, I don't want to live if I don't have kids. Like, that was kind of my mindset back then. And he said, okay. And finally, we decided to like tell our families what was going on and like update them. And I actually had to like kind of fight my family about that fertility decision because they were like, go, 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 go. Like, this is going to spread so fast.
Yeah.
And I said no, like that's not what I want. I don't want to rush everything. I was like, I want to go on like with fertility. And I remember they were like pretty like mad, but they weren't telling me. They were telling my dad and my sister. And my dad and my sister were just trying to like protect me from everything that was going on. So yeah, they still came to visit, and I think they tried their best not to like say anything about that. They were just like bringing flowers and stuff, but so then next came like the fertility treatments. It was about 3 weeks and they were able to harvest like 16 eggs. And actually, during that time, I learned about second opinions. Yeah, I learned about second opinions. Some people had told me, hey, like, you're at a great place, your oncologist is great, but that's not normal. Like, you being 28. In my head, I'm like, oh, I know people who have like breast cancer and stuff. And they're like, no, you have lung cancer. And I said, oh, okay. And then they were telling me, they're like, just, look around. So then I decided to go for a second opinion. I heard of like a great doctor in Chicago. And then came the conversation with my oncologist. I was like, I'm going to go for a second opinion. She's like, why? Yeah. What's like the reason? And then that guilt. Oh my, I was like, holy, yeah, the guilt was just like, well, I was like, well, I understand that my like story is unique. I had to like explain to her. It was like breaking up. Like that's what it felt like. Cause
You
yeah.
end up breaking up, but you just went for a second
Yes.
opinion. You did end up.
Yes. I did end up going after the second opinion. That was after they actually made the radiation plans already. They were ready. Like it was just a few days from me actually doing the chemo. I was like, I'm sorry. Like, everything was like ready to go, but I'm like, okay, there's this like 3-day window, and then I went to go see this other lung cancer specialist, and I was like, they understand everything that's going on. And then instead of like the 6 rounds of chemo, he was like, no, you only need 2. And then I think by that time, I was always like ready to fight. I was like, what do you mean 2? He's like, well, I've been working with like lung cancer patients for 40 years, and I understand like your body doesn't have to be so harmed by chemotherapy. I've seen people have great results with just 2, and let's try that out first. And the way he was explaining it, I was like, that makes so much sense. So I stayed with the second opinion team.
Aurora, when did you do biomarker?
hmm That was, yeah, with my first oncologist, the
Okay, so,
biomarker testing.
yeah. Did
hmm
you do it before doing the treatment plan?
Yes. That was actually, I think, around those, like the days with December 6th of when I was diagnosed. But it was also rushed. They were like biomarker testing, mutation, and I was like, what are they talking about? I think my brain was just so overwhelmed. And when they actually said the word mutation, I was like, what do you mean mutation? Like something's, I think of like the Hulk or some cartoon character. I was like, is like the cancer gonna turn into something else? Am I gonna become this weird thing? And they were like, no, it's just to figure out the best treatment plan for you. hmm
Remember you talking
Yeah.
about I remember the health analogy.
hmm
How did you
Yeah.
when did you go from like thinking it's a bad thing to thinking it's a good thing?
The biomarker. Right when they explained it, but that happened after I was already kind of like on the edge. I wish they had said like we're gonna do this testing to figure out your treatment plan, and it's called biomarker testing. Like that would have made sense instead of we're gonna try to figure out your mutation. Because I was like ninja, I was thinking of like the Ninja Mutant Turtles. I think that's what they're called. Yeah. Mhm.
Interesting. Okay, okay. So second opinion doc, you break up with the first doc. So
Mhm.
surreal. That is surreal. Okay.
Yeah.
You switch
Yeah.
care and you go from many cycles of chemo to 2 cycles of chemo. Did you get target? Wait, can you
Mhm.
remind me? Did you have targeted therapy? I can't remember.
Yeah, so I did 2 rounds of chemo at the same time of 30 days of radiation. And then actually, yeah, what's interesting is I was supposed to have surgery because I was irresectable because the cancer had already wrapped around the lymph nodes. And so they were preparing my body for surgery, but
Hmm.
the chemo and radiation worked so well.
Hmm.
When they were explaining targeted therapy, I was like, why can't I just go straight to targeted therapy? So I'm
Yeah.
actually that patient who didn't do the surgery. I just did chemo, radiation, and now I'm on targeted therapy.
Oh, so they didn't give you targeted
hmm
first,
No. Mm-mm.
even though
Yeah.
you have a mutation?
Right? I wonder that too. Yeah. No. Mm-mm.
And and did you ask? Because like the thing that struck me in your introduction, by the way, is I think you said two
Yeah.
things that like really hit a chord with me. You said
hmm
back then I didn't ask a lot of questions, and back then I was still trusting the system.
Yeah. I didn't ask. I think the first time I asked was really like the surgery. I was like, why is this necessary? if you guys know, so many like stage 4 patients where the cancer is like kind of disappearing. Like they presented it as a miracle drug. I think I did wonder back then. I was like, why didn't I do that first? But I wasn't like asking
Mm.
because I was like, they're lung cancer specialists at like a research hospital.
Huh. Would you have
hmm
asked me?
I think if that was me today, yeah, I think I'd at least come with like the Manta planner or my journal because I learned that you need a piece of notebook to look like you know what you're talking about. Because at first I wasn't bringing anything. Now I'm like, I have my notebook. I'm ready. hmm
Mm.
Now I'm more comfortable with like asking. And I think they know too that I do advocacy stuff. So I think they're more ready if I'm,
Yeah.
you know,
Yeah.
yeah. hmm
What got you to being more comfortable?
What was that?
What got you to becoming more comfortable? Like what changed?
Mm, what changed was I think that moment about surgery.
Mm.
That was one of the first few times I actually like really spoke up because I was like, I'm not doing that because it was to the point where I had already talked to like my surgeon and they were planning everything. I was like, here we go. I have to speak up again, just like the second opinion thing. And it worked. So every time I saw like me speaking up actually changes things to how I wanted it, it
Yeah.
gave me more confidence. Because there were always those moments where they're like, any questions? And I just stare at them and I say, no. But then there was really all these thoughts going on in my mind.
Yeah.
Yeah.
Hmm.
Mm-hmm.
Interesting.
Yep.
And where are you today? So you're on targeted therapy today.
Mm-hmm. I'm on targeted therapy today. Yep.
Aurora, can I ask you a difficult question?
Go ahead. Mm-hmm.
You don't have to answer it. You can be like, Samira, we're going to
Mm-hmm.
skip this question. We're going to move on.
Sure.
uh,
Mm-hmm.
how do you grapple with the uncertainty of the future? And like, how long?
Mm. That's a really good question. So that person, I think it was almost 2 years ago before I went on targeted therapy. My question was like, how do you know this isn't going to come back? I started asking that question to my doctor, and they were like, well, this drug and like the statistics, it's really good. And they were like, it's like a cancer police. And I think that wasn't enough for me. I was like, medication, like, I was like, this is going to come back. So, one thing with social media, there was one account I followed, the
Yeah.
cancer patient, and I think I just like laugh it off. Yeah, I'm just like, one time I reposted it, I was like, I think this is too dark for my family. Because I'm always like, trying to comfort them about my diagnosis as a
Mm.
young person. But it was really when I attended the Hope Summit last year that I met people who've already experienced the worst, which is reoccurrence.
Mm.
And they kind of explain, like, it can happen anytime. They're like, I'm not gonna lie to you that reoccurrence is not a thing, that don't think about it, They said, well, when that happens, you'll know exactly what to do. You know what questions to ask. You'll be more prepared. And if things work out, research has already advanced at that time. And so when they told me that, I was like, oh, like you're right. It's not going to be like how I was in September, like not knowing anything. They were like, you're more prepared the next time around. hmm
How do you handle your family?
That's a really good question. I think I have my own world with advocacy. Even now when I'm like, oh, I was scrolling on Facebook and this girl had reoccurrence, and they're like, don't say those things. So I journal a lot actually. This is my fourth journal of the year. You see how thick? Yeah, I'm on day like 450 of journaling, but a part of that's like, okay, I think of the worst. I'm like, if something happens, I leave behind something with my family, but also like I'm able to brain dump things.
Yeah.
Yeah. And I'm, dreaming of like traveling. I'm like, well, you never know what happens, lung cancer or no cancer, right? So like just I think trying to make time for like travels as well.
Hmm.
Mm-hmm.
How has life changed for you with the cancer diagnosis?
Mm. So I'll tell you what a nurse told me. She's like, the only people you could surround yourself with now is healthy relationships. And at that time, I was teaching in a school, and like, I would tell you my day to day. I would go to that school, and I loved my students, but be stressed out by administration. Go home, do more paperwork, take a break, go to sleep, wake up at 4 a.m. to do more paperwork. So it was just like the
Hmm.
grind. And I was also in school, so I felt like I was just like running like a hamster on a wheel. But ever since the nurse told me like you need healthy relationships, so I started really like evaluating how people talked to me and treated me. I never went back to that job, and I work remote now. So that's a big thing. We actually moved out of state but came back. So that was another big jump. But I think for me, life has changed. Like, my purpose now is hoping that no other patients go through what I did. So I try to talk about it a lot via like social media.
Hmm.
Hmm.
Um, hmm. How are you getting through your day though?
My day,
Mm-hmm. Because it's helping
every
other
day.
people, and I am with you. I share that. I think
Yeah.
like I think we're on very similar paths, right? Like they're
Mm-hmm.
not diagnoses, but like I think very similar in terms of like chapter two, three, four of life is about giving back to this community and making sure that
Mm-hmm.
they go through the same things we went through. So I think we're very similar in that way. So
Mm-hmm.
like that takes up the vast majority of space, but that's also just that like
Mm-hmm.
sometimes it's just hard.
Yeah, like it does get heavy. Like today it's rainy outside, so my mood's reflecting that. Um, yeah, and I think it's finding the balance of like, okay, let's do everything now because you never know how short life is. And then when that's over, it's like, oh shit, I'm still here. Like, I'm still only 31 and I'm still trying to build this life, but there's, yeah, that moment where you're like, holy crap, like there's still so much time, but at the same time, there's not a lot of time. Yeah.
Oh my god, I feel you.
Yeah.
I
Mm-hmm.
feel you on that one. It is not even funny. I fully just that
Right. Right. And when
hard.
somebody brings, mm-hmm. Yeah, and when people bring up retirement, I'm like, what's that?
So
Because,
here's a question for you. How much in the
mm-hmm.
future
I'm
can you look?
sorry.
You're
Mm-hmm.
fine. How much
Mm-hmm.
in the future can you look?
Not past 50. So my mom passed away at 57. Yeah, my dad's still here. He's actually upstairs. But when I saw my mom go through that at such a young age, I was like, she was like that immigrant mom, just working so hard and got so sick. So I think I learned my lesson of like, you're so like dispensable by all these companies. You know, you work so hard and you get money, but then you spend that money. So I think I've had that outlook of like, yes, you need to like live life, but yeah, I think honestly, when I visualize things, it's like 50s.
Hey, you
And I
did
don't
better.
know what happens after.
Right, at least you got to 50.
Right. How
Like
about you?
I don't think I can see past 40. Like
Mm,
and it's wild, right? Because I had early stage breast cancer, so like the statistics are actually like I don't have a rational reason to not see beyond 40,
mm-hmm.
right? Like it's
Yeah.
but my brain just doesn't get there. Like and that too has been progression. Like in 20 so I got diagnosed 2020.
Mm,
I couldn't see past 3 weeks. 2021 I was like, okay, all right.
mm,
2022 was like, oh okay, like 3, 4, 6 months, 7 months, okay. 2023 was like 1 year, and I was like, huh, I can see out 1 year. Like that's pretty. Like I was like, oh my god, mind blown. 1 year out, yes, score.
yeah.
Today I'm like, 2 years, 3 years, 5 years, 6 years, like that.
Mm-hmm.
And like visualization past that is super hard. I
Yeah.
can't do it yet. Like I
Yeah.
so man, kudos to you. Good job getting to the 50s.
Yeah. Mm-hmm. And so I was raised in the Philippines, And I think when my family thinks about retirement, they're like, I want to go home. I'm like, I'm 31, I'm ready to go home. Like that's my mindset. I'm like, I'm ready to be around like the mangoes and all of those things. It's like what my family thinks they'll achieve at like 60 or 70 is like when they rest. And I'm like, I'm ready to rest. I'm like, I'm ready to chill out.
Why don't you? Why not go back?
Yeah, that's the other question. My husband's actually, he can't go back or he
Mm,
can't re-enter this country. So there's that. Yeah.
I see.
Yeah, we have that other dynamic in our marriage. Yep.
I feel you. In our
Mhm.
opinion, immigration is
Mhm.
hmm,
Yeah. Yeah, definitely. And immigration doesn't care if you're sick. That's the other thing. Yep.
a lot of quotable quotes from this one. I will tell you that much.
Mhm. Mhm.
Okay, so
Yeah.
here's my like wrap up question for you.
Mhm.
Someone got diagnosed today, okay, and lung cancer, AYA, you can take it.
Mhm.
Like, what are the three things you might tell them to do?
Hmm. Do not search on Google because it's gonna feel like a death sentence. You'll see, like, I saw the statistics and I was like, that's gonna scare the shit out of you and your family and your friends. I would say actually go on TikTok and look for survivors there. That's the other thing I would tell them. Yeah. And the other thing would be go on Facebook and join either search lung cancer or if you already know your biomarker, go search those groups. You'll be surrounded by people that know exactly what you're going through. Number three is like speak up. Bring that notebook or that planner to your appointments and look like you know what you're talking about. Because if
Hmm,
you just look lost or tired, it's easy that they'll overlook who you are and you're just another number, another patient.
hmm.
Yep.
Thank you for sharing that.
Thank you.
I cannot explain how happy I am that you are finally a guest on this podcast.
Oh, thank you so much for having me.
I
And
forgot
I'm
one thing.
learning. Yeah.
I forgot one thing. You did something this weekend.
Yeah.
We forgot
I
about it.
did. I recorded my first podcast via
Yeah.
Substack.
All right.
Yeah.
What's it
So,
called?
I don't have a name still.
No
That's the
worries.
thing. It's just kind of like a Substack blog, but I will figure out the name soon. But that's the other part about resting is like really believing I'm a creative and diving into that instead of just doing work related things. I'm like, let me do creative things that supposedly we don't have time to do, but we really do.
I love it. All right. We're going to link
Mhm.
your Substack
Mhm.
blog, newsletter.
Yeah,
You need to give us a link because we
I
can link.
will. Or search Aurora Lucas Substack. It should pop up.
Hey,
Yeah.
Aurora Lucas Substack.
Thank you,
Thank you so much.
Samira.
Really appreciate it. Thank you.
Mhm. Thank you.
This podcast, show notes, and newsletter is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice, and no doctor patient relationship is formed. The use of information on this podcast or any materials linked from this blog is at the user's own risk. The content here is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they may have and should seek the assistance of their healthcare professionals for any such conditions.